Today I'm going to talk about professionalism and ethics. This week I was involved in a family meeting in regards to a patient that no longer wanted any extreme measures taken. She is a patient that has come back to us from a rehab facility because her previous admission, she ended up having to have a trach put in. So she came back to us from this rehab facility after she had been home for about a month. Her trach had healed over, and she proceeded to smoke 2 packs of cigarettes a day and put her into severe respiratory distress. So she's come back to us. She is now on a vent. And upon her last admission, she had no DPOA paperwork signed, and she had her son, who was made a surrogate healthcare decision maker, which is a new law here in New Hampshire where that person can be assigned by a physician. It doesn't necessarily have to be a family member. It can be a friend, a relative, whatever. So her son was made this surrogate healthcare decision maker the last time she was admitted to us. And at the time, it had seemed that she had some mental instability and was not going to be able to make her own decisions. So it was advised that her son go for guardianship against her. And in that time frame, the patient got a little bit better, so the son stopped pursuing guardianship. Well, when she came back to us, she's been with us now for 2 weeks, and she's been on a vent for 2 weeks at 55% oxygen, which means that we are providing her 55% of her body's oxygen through a vent, which means that she has been on the vent for 2 weeks, so her likelihood of coming off of the vent and without a trach is very slim to none. So on Monday, she had stated that she no longer wanted to do any of this. She didn't want a trach put in. She didn't want any extreme measures taken, and had proceeded to pull out her NG tube, which is a tube that we put down the patient's nose. It can be used for 2 reasons. 1, to suck things out, or 2, to provide food as well. And it was in her best decision to have a nasogastric tube put in instead of a PEG tube, which is inserted directly into the belly through into the stomach through the belly. So she ended up pulling out the NG tube, and then yesterday was trying to pull out her vent tube, so she ended up having to be put in soft restraints so she wouldn't pull her tube out. So the son was called to come in and have a meeting with the respiratory therapist, the nurse, the doctor that's taking care of her, as well as the care management department. So I was able to be a part of that meeting, and it was very traumatizing for both the patient and the patient's son. It was a meeting that I don't think went very well at all. I don't think that it was done appropriately. This is a very difficult decision for this woman to make. It's also a very difficult decision for the son to be a part of. So he at one point had asked us to leave the room because it was pretty much everybody was surrounding the bed and trying to tell this woman, okay, you're going to die if we take this tube out. Do you understand that? And she kept stating yes, that she did. She wanted to go home. So everybody in the room basically took that she just wanted to go home and that she wanted to resume her lifestyle. The patient was able to write down that that's not what she wanted, and nobody was really paying attention to that fact. So I ended up leaving the room. I was very uncomfortable with the situation. The care manager that was in the room decided to stay in there, and I felt was very inappropriate in the way that the care manager was speaking to the patient and to the patient's family. There was no compassion at all whatsoever. There was no empathy for the patient. It was more about trying to get the DPOA paperwork signed so that the son could make all of the decisions for her. The son did not want to have his mother extubated off the tube because chances are when she came off of the vent, she would turn hypoxic, most likely, and probably have a heart attack and pass away. The doctor at the time ended up having to leave the room for another emergency. It was due to come back, but it took him quite a while, so I wasn't in the room when the doctor came back. Actually, it was just the family and the doctor, apparently. I don't know what the outcome is. I'm just basing this video off of what I was able to be a part of. She stated again that she didn't want the tube in and that she knew that she was going to pass. This is a woman who is 53 years old, has a severe health history. She's not a healthy individual. Her chances of having a trach put in and surviving another attack of respiratory distress would most likely kill her, and she knows this. So the doctor had recommended that if she wanted the tube out, and that was her decision, that she could be put on comfort measures where she would be made comfortable and she could pass peacefully. The son was trying to talk her out of it, which is understandable. This is his mother. He's not, nobody wants their parents to pass away. So it was definitely very hard to watch him, but it was very disturbing to me to have all of the other personnel in the room really not respecting her wishes, because they're basing her mental assessment on the last visit that she had. Well, she was delirious the last time because she was deprived of oxygen, and that tends to kind of make a person a little crazy, I guess, if that's how you want to put it. So I was really taken aback by it all. The philosophy of that I have is that you respect a patient's wishes, you respect an individual's wishes in regards to their life care. She knew what would happen, and she was okay with it, and she had made peace with that. And I think by everybody kind of just jumping on her and saying, you're going to die, you're going to die, you're going to die, if you take this out, this is what's going to happen, we know you don't want this. Well, the patient didn't verbally state it, but she wrote it down, which is a legal form of saying, I don't want any extreme measures done. And nobody really respected those wishes at that moment. Like I said, the meeting continued, I guess, after 6 o'clock last night, so I don't know the outcome of whether or not they chose to pull the tube or not. I won't know that until I go back next week. But I'm just was really upset with how the meeting went. I don't think that they were acting in a professional manner. I think ethics was a huge portion that came into play in this. Nobody was really listening to her. It was all about, okay, well, because she's 53 years old, well, you have to look at her quality of life after this. You put a trach in, she'll never come off of that trach. The amount of infection that she can get is increased extremely with a trach. And this is a woman who does not have any really good life skills in regards to how she takes care of herself. So her having a trach isn't going to change her life skills. She's still going to resume what she was doing before. She even stated that. So she is basically wanting to end her life without, and wanting to pass on her own terms. And again, she was ignored. So the patient became very distressed and very tearful. And then the son finally asked us to leave the room. So at that time, I was standing outside of the room just listening to the conversation. I did not want to be a part of that. I didn't feel that they were really abiding by her wishes. So that was kind of disturbing for me this week. I really was really kind of hoping that everybody would kind of jump on board with her. This was her choice to make. Even the respiratory therapist had stated that there was really no other outcome, whether she had a trach or not. It would just take her a little bit longer to pass away. So the patient decided that she wanted to do it on her own terms. So the only person that was really for the patient was the doctor and the respiratory therapist. I'm not sure how the son was doing after that. So that's one issue that I had this week. Another issue is in regards to ethics, and I know I'm way over my time again, is that there was a patient that was admitted to the hospital that was well known to one of the care managers in the department. And this particular care manager has a specific assignment on a different floor than this patient was admitted on, and decided to approach the care manager that was dealing with this patient and asked if he could take this individual because it was somebody that he knew and that he wanted to make sure that he got the best care. And I was working with this particular case manager at this time. And I actually recused myself from that case. I didn't feel that it was professional or ethical in any way. I don't think that he should be taking on a patient that he is very, very close with and well known. I thought that it was wrong of him to do so because every other patient that is admitted to this hospital has the exact same right to care and to the social workers as this particular patient does. But because this care manager felt that he wasn't going to get the care that he deserved if he didn't take on this patient, so I had basically said that I will not be a part of that. I don't think that that it was right to do so, but I don't work in that department. I don't really understand how that department, I shouldn't say I don't understand, but I don't know what the protocol is for that, and I really didn't get a chance to ask the director of that department how they feel about taking on patients that they know. And it was actually a patient that was on the floor that I work with at night, so I wouldn't have taken that patient anyway, because that would have put me in I think in an unethical position, because I would be seeing that patient as a social worker during the day and coming in as a nurse at night, and I don't know, I think that would make the patient uncomfortable. It would make me uncomfortable because they would see me in two different aspects, and I'm trying to keep my my field placement separate from my work. So if I have a patient that comes in and I'm scheduled to be on that floor, I will actually switch floors so I don't work with any of the patients that I come in contact with on my night shift. So I guess my question is to you is, how would you feel? I guess I just want everybody's opinion in regards to the family meeting, if you felt that me leaving the room was inappropriate in any way, shape, or form, as well as recusing myself from taking care of this particular individual that the case manager that I was working with is friends with. Yeah, so that's it. I hope everybody is having a good week, and again, I'm sorry that I've gone over my time. I look forward to all your responses. Thank you.